Great. Hello everyone, and for all of you here in Geelong, welcome. I can hear the excitement because we're face to face and acknowledge that we've got people in Ballarat and in Warrnambool. So welcome. For those who haven't met me, my name's Rowena Clift. I'm the Chief Executive Officer of Western Victoria Primary Health Network. Before we get started, I'm really excited to introduce Karina Eccles of the Wathaurong Aboriginal Cooperative to perform a welcome to country and to open our conference. Thanks, Karina.
Wathaurong Malup. In Wathaurong language, I say Wathaurong spirit. May we acknowledge Wathaurong spirit of Wathaurong country. Wathaurong spirit of Wathaurong people. Wathaurong spirit of Wathaurong mother tongue, Wathaurong language. Durang, 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 Durang. In Wathaurong language, I say heartbeat. May we acknowledge the continuing heartbeat of our mother. Our mother that was created by our Karingalabil, created by Bamjul. Our mother has nurtured and provided and cared for thousands of generations of Wathaurong people, many generations of your people. Our mother is our mother country, our mother earth, Wathaurong country. I acknowledge Wathaurong ancestors, Wathaurong people of today, and I acknowledge all First Nations people that are gathered here today. I acknowledge the people that are online, and I acknowledge the First Nations lands in which you're all gathered today. I also want to pay my respects to a community elder whose spirit has gone to the dreaming in the last couple of days from our local community here, the Wathaurong community. I pay my respects to the family. Here you are all gathered on Wathaurong country, here in Geelong. Geelong is the traditional name of Geelong. The name Geelong. Geelong derives from the name Geelong, and it means a tongue of land. But you are gathered here on Wathaurong country, the country that was known across the Kulin as the people of the water. And our country, our mountain country, our Yaluk, our freshwater country, our Wari, our saltwater country, our beautiful country that my ancestors nurtured and were cared for by their mother country. So welcoming you to country gives you the rightful passage and a safe passage on country. So I'll now welcome you, just like my ancestors did for thousands of generations, to welcome people to have a safe passage on country. Muam bengoringadak, kinkin bil, wedigaranguli Wathaurong, na lingu wikimbani Wathaurong ja, punani tulama bengadak ba, gayupanguma, maradok, Makbori. In Wathaurong language I say, from my ancestors, family and community, I welcome you all here on Wathaurong country. Let us all come together, embrace each other and gather in peace. Kimbani Wathaurong ja, Gayupanguma Wathaurong ja, Gubada Wathaurong ja. Welcome to Wathaurong country. You gathered on Wathaurong country, and take care on Wathaurong country. Nyatni. Thank you. Thank you.
Thank you for that wonderful welcome, Karina. And I just want to say also thank you for your leadership that you're providing. And I was privileged enough to hear some of what Karina and the Wathaurong people are planning around leadership for First Nations people in this region. So thank you for everything that you're doing in that space. It also gives me great pleasure now to introduce Lynn McLennan. Lynn is the chair of Western Victoria Primary Healthcare Board, and she will give the opening address to the refresher. Thanks, Lynn.
Good morning. Can someone let me know that people can hear me?
Yes.
So welcome everyone to this special annual event, our very popular Primary Care Refresher for 2022. My name's Lynn McLennan. I'm the chair of the board of Western Victorian PHN. And I'd like to thank Karina for the welcome to country that we've just had, and also on behalf of the Western Victorian Primary Health Network, acknowledge the traditional owners and custodians of the lands and waterways on which we live and work, the Wathaurong people, the Gulidjan, the Gulabanud, the Kirrawurrung, the Peekwurrung, Gunjamara, Jabwurrung, Watchabalak, Jajarwarrong, Jadwajali, Wurgaya, Jadwa, and the Yupagog peoples. So we recognise their diversity, their strength, their resilience, and the ongoing place that First Nations people have in our community. We pay our respects to their elders, past, present, and emerging, and continue to work together in the spirit of mutual understanding, respect, and reconciliation. We support self-determination for First Nations people and their organisations. I'm really delighted that there are so many primary care colleagues attending today, some virtually and some in person. So it's good to be able to do this event. I've certainly, on my behalf, I've been involved in the primary care sector in a number of different ways over the last 40 years, and I'm currently the CEO of UFS Dispensaries, which is a social enterprise operating a range of medical and healthcare services, which include general practices and pharmacies. And it's been my privilege to be the independent chair of the board of the West Vic PHN since 2015. And we all know that the primary care sector has provided an absolutely phenomenal level of service to our communities over the last 2 years. I think that the adaptive challenges that we've all faced and the absolute sheer workload volume that everyone's experienced means that events such as this, where as colleagues we can gather and learn from each other, are probably more important than they've ever been. COVID-19 has certainly been the biggest healthcare challenge of a generation, and we don't know quite yet what it means for the future of primary care, or we've got some slightly scary thoughts about what the future might bring. But it is very important that we share our experiences as this evolves, this situation, and that we learn together. And hopefully we can use some of the rapid adaptations that we've put in place in the last 2 years to leapfrog into a better future for the primary care sector. And we know that, you know, there's been a primary health 10-year plan. I don't know if you're like me, you've seen a lot of plans over the years, but this one's got some excellent strategies in it. And let's hope that the federal government continues to work with the state governments and we get some actual implementation and change. So we've been listening at the PHN to you about things that work and things that don't. And I think it's really important that you keep telling us what's helpful and what isn't helpful, so that we can give you the best support to deliver excellent primary care that we possibly can. So this year's refresher is called The Journey. It's been a heck of a journey. The journey of primary care through a pandemic. So it's really a timely opportunity, I think, for us all to reflect on what has happened and what we can learn as we collaborate to build a better future. So I would like to acknowledge and extend a warm welcome to our keynote speaker for today, Professor Michael Kidd, AM. Professor Kidd was our keynote speaker at last year's refresher, and I'm going to be very interested to hear his reflections on the COVID pandemic yet another 12 months on. Professor Kidd is the Deputy Chief Medical Officer and Principal Medical Advisor with the Australian Commonwealth Department of Health, and he's been leading Australia's primary care response nationally through the COVID-19 pandemic. He's also the Foundation Professor of Primary Care Reform at the ANU. So I'd like to also extend a big welcome to all of our presenters and our panel members who will be speaking over the next 2 days, and also the conference facilitators, Dr. Bianca Forrester, Dr. Anne Stevenson, Claire Dagley, and Matt Dixon. So if you're looking for more information on the presenters and the facilitators, please refer to the conference booklet. So this year, as I mentioned, we've got people both online and face-to-face, and there are 2 important streams. The GP stream covers important topics relating to GPs only, and the more general primary care stream covers important topics relating to GPs, practice managers, practice nurses, practice staff, and allied health professionals. So I would like to formally welcome you and open the conference. Thank you all for joining us today, and I hope you do enjoy our 2022 Primary Care Refresher Weekend. I'll now pass you back to the Western Vic PHN CEO, Rowena Cliff. Thanks for listening.
For providing that warm welcome. We've got over 200 people registered for the Primary Care Refresher this year, and this is our key event, but it's really exciting to do it in a hybrid format. The team came to me and they said, we need to do something new and something different, and this is where we are today, and we'll try this hybrid format, and you're very welcome to feed back to us about how it works. It's great to have some face-to-face across 3 venues. We're here in Geelong, there's teams in Ballarat and Warrnambool, and we've also got our online audience. We're really delighted to offer this event in an accessible format this year that means no matter where you are or how you're feeling at the moment, this weekend we can all come together to connect and to learn from the incredibly insightful presentations and discussions to come. Western Victoria Primary Health Network has an important role in helping deliver the best practice primary health care across our region, which comprises of 21 local government areas and a total population of approximately 618,000, and I think growing every day. A vital part of the work we do is to support general practice and all our primary healthcare professionals with the resources and opportunities to expand their knowledge base and overall professional development. This annual Primary Care Refresher is a keynote event that helps us achieve this objective, with this year's theme being the journey of primary care through the pandemic. We know the pandemic has thrust many significant challenges on the primary care sector, but it's also provided a moment for us to reflect on how we have done things in the past and how we can improve our ways of working moving forward. What it has demonstrated is the integral role primary healthcare plays in keeping our communities healthy and safe. I would like to take this opportunity to thank all of our primary care providers for all of their work during this past year. It is due to you that our communities have some of the best vaccination rates in Victoria and Australia. Our refresher event encourages primary care professionals to learn with peers and gain new insights to ensure that we're all informed on contemporary and best practice primary health care. I also want to take this moment to thank the Western Victoria Primary Healthcare team who worked tirelessly in the background to ensure that this event is a success. It's now my pleasure to hand over to our keynote speaker for today, Professor Michael Kidd AM, Australian Government Deputy Chief Medical Officer and Principal Medical Advisor. Thank you again to Lynn. She provided a wonderful introduction to Michael and his work. And just before I hand over to you, Michael, I will remind the conference delegates that our conference chair for today is the wonderful Bianca Forrester, who's a GP and works with Western Victoria Primary Health Network as Clinical Advisor on Workforce Development. And we've all seen a bit of Bianca in Project Echoes 7:30 every Thursday morning. Bianca will be facilitating a question and answer session with Professor Michael Kidd at the end of the keynote address. We also encourage you to submit questions for Michael in this session. For our face-to-face attendees, you can submit your questions via the event app. For those attending online, you can submit your questions via the event portal. Look for the green On button at the bottom right of your screens. Thank you everyone for taking a time on a weekend to join us in this new hybrid format. I hope you enjoyed day one of the 2022 Primary Care Refresher. Thanks, Michael. Over to you.
Thank you, Rowena, and good morning, everybody. Someone's got the thing for me. Thank you. And thank you for the opportunity to be here with you again this year, but this time in person in Geelong. It's great that we are starting to open up again and be able to travel around again. Also like to start by acknowledging the traditional owners of the lands where each of you are meeting today. I'm no stranger to Western Victoria. As some of you will know, I worked for some time in Dimboola, out in the very far west of this region, and it's really good to be here with you today, and also acknowledge those of you who are watching from Warrnambool and from Ballarat and from your own homes via the live stream. I want to say a big thank you. I want to say a big thank you. Thank you to everybody here today. Thank you for the extraordinary work that you've been doing over the last 2.5 years, supporting your individual patients and your communities as we've lived through the COVID-19 pandemic. Hearing a talk about COVID-19 is probably the last thing you feel like doing on a Saturday morning, but I'm going to try and get you to think back over some of the things which have happened over the last 2.5 years and how that may help to drive changes in the work that we all do. But I think that our nation owes a debt of gratitude to all of you, to the nation's general practitioners, primary care nurses, allied health professionals, pharmacists, the people who support our health professionals every day to do the work that they do, our practice managers, our receptionists, everybody involved in delivering primary care to Australia. Primary care in Australia has stood up at a time when our communities really needed us. And you've all done things above and beyond the so-called call of duty over the last 2.5 years, supporting your populations. And I hope our population doesn't forget the contributions which have been made over the last 2.5 years. I also wanted to acknowledge the work of the PHN, because our PHNs have also stood up over the last 2.5 years and have been involved in sharing information with you on a regular basis about what's happening. I don't know if you remember back in the early days in February and March of 2020 when we were all confused about what was happening. We were all searching for answers. We were all asking lots of questions. Our PHNs have been involved in distributing personal protective equipment out to practices across their regions. They've been involved in identifying the sites for the general practitioner-led respiratory clinics, and you've had a number of those established and still operating in this region of the country. They've been involved in the vaccination support, and Rowena said you've got one of the highest rates of vaccination in the state and the country, but also in the world, because Australia is one of the most highly vaccinated countries protecting our population against COVID-19. But very importantly, the PHN has got to understand the community that the PHN serves as well in ways that we've never seen before, and particularly supporting outreach to priority populations, to people who have been most vulnerable to COVID-19. And one thing that a pandemic does is it shines a light on often forgotten groups of people in our communities. Now, they're not forgotten by those of us working in general practice and in primary care, because we see these people all the time, but they're forgotten by governments and they're forgotten by leadership. And also, the PHN has been working with your local health districts here in Victoria, looking at community care pathways for people with COVID-19. This week has been National Reconciliation Week, and I don't know if you've been involved in activities with National Reconciliation Week. National Reconciliation Week starts each year on the 27th of May, which marks the anniversary of the successful 1967 referendum. and it continues until the 3rd of June, till yesterday, which marks the day that the High Court brought down the historic Mabo decision about native land title. And it is a very important week in our nation's history. It invites us to think about reconciliation. This year's theme has been about being brave and making change, being brave in the decisions that we make and doing all that we can to support reconciliation. But I think it's also a nice theme for the experience that we've been going through the last 2.5 years about being brave, stepping up when we're needed, and making change. So on to COVID-19, and I just wanted to remind you about some of the dates that we've been through. So cast your mind back, the 31st of December 2019. This is the day when the Chinese authorities reported a cluster of pneumonia cases in Wuhan in China of unknown origin, and they reported it to the World Health Organization on the 31st of December 2019. The cause of those infections, of course, was the virus that we now recognise as causing the disease, COVID-19. The 19 refers to the year in which it was first reported. So if the Chinese had reported it the next day, January the 1st, 2020, it would have been COVID-20, which might have been more appropriate given the impact on the 2020s that this particular virus has had and is continuing to have. The very next day, the 1st of January, Australia set up our National Incident Room to start to monitor the cluster. And the National Incident Room sits in the Department of Health in Woden in Canberra and is activated when an event occurs which puts the health of the people of Australia at serious risk. It had been activated in 2019 for the bushfires. And was continuing to run for the bushfires at the time that COVID-19 appeared. It had also been activated a few weeks earlier when the White Island volcano eruption occurred, and a number of Australian tourists were on that island and died, and others were very seriously affected. And usually it's set up for a limited period of time. It brings together all the arms of the Defence Forces, it brings together public health, it brings together clinical response, it brings together the police and the emergency services, all into a central location, and lots of communications come out from the National Incident Room. So it was recognised on January the 1st that this could be a serious problem, this new disease which had been reported, and so our incident room was set up. 21st of January, we declared COVID-19 a disease of pandemic potential in Australia. This was weeks before the WHO declared a pandemic, but it was clear that that this virus was starting to spread very quickly. We saw it spread from China to South Korea to Iran and then to Italy. And I don't know if you remember hearing about the cases in Italy very early on, where elderly people were being triaged at the door of hospitals to decide who would be admitted and who would get an ICU bed and who would get a ventilator and who would be sent home to die. And I think most of us were really alarmed that in a country like Italy, all of a sudden this rationing of healthcare was occurring, and people were being sent home who were judged least likely to survive regardless of what treatment was given, and that included elderly people, people with diabetes, people who were obese, and others. 25th of January, the first cases were confirmed in Australia, first one here in Victoria and 3 in New South Wales. And then from the 1st of February, we started progressively locking down our borders. We initially were blocking arrivals from mainland China. Australian citizens who were repatriated from China were required to self-isolate for 14 days. And it wasn't until the 11th of February that the WHO declared the pandemic and named the virus and the disease COVID-19. Now, I remember I was working in Toronto in Canada at the start of 2020, and I remember being really incensed that this new virus had appeared, and it appeared to have occurred in a wet market where animals are brought together in very crowded and unhealthy conditions of multiple species all crowded together. We'd seen the wet markets as the source of the SARS pandemic of 2002, 2003. Now remember SARS? SARS was another coronavirus, and it caused very serious respiratory disease and death in a large number of people who contracted it. Everybody who contracted the SARS virus became very seriously unwell. We had 6 cases in Australia, but fortunately no deaths. But where I was working in Canada, in Toronto, Canada had 251 cases and 44 deaths from SARS, including in Toronto 3 healthcare workers who died from SARS. So the practice that I was working in Canada, we were immediately recalled to be fit tested. I've been fit tested for respirator mask on my first day working in general practice in Canada, as was the norm, and then we were all recalled as soon as this new virus appeared. And what struck me working in Toronto was the shadow of SARS, which was very long. Even though it had been 18 years ago, it was still very long. And the mourning for the healthcare workers who died. And the healthcare workers who died were a GP, a community nurse, and a nurse in one of the teaching hospitals. So it showed that these viruses occurred out in the community as well. So I got a call from Brendan Murphy. I was planning to come back to Australia in May of 2020 when my working visa ran out, and he said, I think you need to come back earlier and come and give us a hand in Australia with the response, if you don't come back, you may not be able to come back at all. So I jumped on a plane and came back to Australia. 27th of February, the national plan was released for tackling COVID-19. And I arrived on the Monday after, and I said to Brendan, what would you like me to do? And he said, we need a national primary care plan. I said, okay, what have you got? Nothing. When do you need it? The Minister needs it by lunchtime tomorrow. So, fortunately, I'd come from Toronto. And in the aftermath of the SARS pandemic, with the deaths, particularly in healthcare workers and the 44 deaths in the community, there have been a number of royal commissions and inquiries. And during my time there, I'd combed through all these reports to try and find out what lessons could we learn from that pandemic that may help with future pandemics. And it had really struck me that every hospital that had been built since SARS in 2002 in Canada had been built to be able to be converted overnight into a fever hospital with single rooms, single bathrooms, and that's something that we hadn't thought about here in Australia. We were still designing as we were before. And I think, again, we need to learn the lessons from the last 2.5 years because it'll influence where we go. So, the plan. What did I do in the first day and a half working for the Commonwealth? Looked at a set of principles about how we might respond in primary care. And the first principle was really important. What we were seeing was that the people most affected by COVID-19 in China and in other countries were the people we cared for in primary care and the people who were often the most vulnerable in our communities, the elderly, people with chronic disease, people who were immune compromised. And so part of the plan was looking at how do we support primary care to continue to provide care to the most vulnerable, to protect them from becoming infected, and if they did become infected, to offer them treatment. And part of this approach was the introduction of telehealth and allowing initially, you may remember, initially telehealth was available to people who met the criteria of being vulnerable. Then it was extended 2 days later to acknowledge that some healthcare professionals were vulnerable as well and therefore could do telehealth and consult remotely. And then within 10 days, it was the entire population getting telehealth. And you talk about rapid reform on the run. We were planning to introduce telehealth over a 10-year period in Australia. Instead, we introduced it over 10 days. And it's now here to stay. We've had over 100 million telehealth consultations since it was introduced back then. The second principle was recognising that we needed to have the capacity to test people with respiratory symptoms, and to also recognise that not everyone with a respiratory symptom would have COVID-19. that there were many other causes of respiratory symptoms as well. And coming out of this was the funding to establish the general practice-led respiratory clinics across the country. 150 were funded. 98% of the population were within a 30-minute drive of one of these respiratory clinics. Thank you to those of you in this region who are involved in setting up and continuing to run the respiratory clinics. And the importance of the respiratory clinics was to allow us to segregate the population. So people who had respiratory symptoms being assessed in a situation with people with high levels of PPE, and the rest of the population still being able to access the health care that they need. So that was the third principle, was about ensuring continuity of care could continue for everybody, for the whole population. And the importance of that continuity of care, and what we knew, again, from looking at past pandemics and epidemics, is that often more people died from neglected care for other reasons than from the infectious agent. And we were worried about people with acute symptoms not getting attention. We were worried about people with chronic conditions not getting their continuing management. We were worried about mental health conditions and the risks of suicide and depression not being well managed. We were worried about people not getting screening for cancers and for heart disease, children not getting their immunisations. So it was important to continue to have general practice functioning. And what we didn't want to do was get to the end of the pandemic and discover that general practice had gone bankrupt all around the country, and we didn't have services available to continue to provide care to the population into the future. And you may remember there were a number of incentive payments which were provided both to the workforce but also to practices during the early days of the pandemic. The fourth feature was this one that I mentioned about people in primary care needing protection just as much as people working in hospitals and emergency departments. And even though I acknowledge that getting access to PPE was very patchy and very difficult, and especially in the early months when we had worldwide shortages of PPE, and who knew that most face masks were made in Wuhan in China, and it exposed, of course, the challenges we have with globalisation and with relying on imports for essential items in this country and in many more. But the recognition that we needed to provide protection to the people working in primary care just as much as we did to those working in our hospitals. And the fifth principle was about mental health. And again, recognising from past experience in pandemics that often there is a very long tail of mental ill health and distress following a pandemic and following the measures which are put in place. We recognise this right at the start of the primary care response, and additional resources were put into mental health care. And of course, we all had a challenge to our mental health in those early days. I challenge anyone to say that they were sleeping properly during March and April of 2020, that you weren't feeling the anxiety that everybody else on the planet was experiencing. And of course, we're continuing to be concerned about the disruption, particularly in the lives of young people, the schooling disruption that so many young people have gone through, and the impact that has on mental health. So here's where we were back in 2020, and I want you just to think back to what you were doing this day 2 years ago. So the 4th of June 2020, what were you doing? So you can see where we were on the curve. We're between the two initial peaks of COVID-19. The first wave had passed, and we'd all lived through our first experience of lockdown nationwide. The entire country had been locked down. We'd had up till then 7,240 cases and 102 deaths had occurred. And we had 128 general practice-led respiratory clinics. The big news of the day on June the 4th was that 6 million people had downloaded the COVID Safe app, presumably, including many of you in the room. It was the first of the digital measures to assist us with contact tracing, and of course we then got QR codes and everything else that we've had. We'd had by that time already 13 million telehealth consultations. So many of us had retreated and were doing telehealth during that initial lockdown. And hotel quarantine was working well, we were told. But we'd seen the impacts. The restrictions were just being lifted, and what we were seeing was different states doing different things, and that was affecting, particularly I'm sure, some people here who work across the border between South Australia and Victoria. We'd seen the impact of isolation and the continuing fear and anxiety in the community, and we'd seen the impact on people with disability who seemed to have been forgotten before then. As I said earlier, this spotlight on populations of people who we often don't provide as good care as we should. But what we didn't realise was that this was the calm before the storm, and that second wave which began in July. A year on, we'd started vaccinating the population, and this chap was one of the first people to be vaccinated to show the people of Australia that it was a safe thing to do. So forward a year, what were you doing on June the 4th, 2021? So we'd had 30,106 cases of COVID-19 reported by then, 910 deaths. Median age, 86 years. The majority of the deaths in this state during that terrible second wave, with the population not protected by vaccination. However, by this time we'd delivered 3 million vaccines to people in Australia, and you'll remember we started off with priority populations, the over 80s, the over 70s, healthcare workers, people working on the front line on our borders. And we were rolling out the AstraZeneca vaccine and the Pfizer vaccine. In the week before, Olympic athletes who were going to the Tokyo Games have been granted priority access to the vaccines, competing in the Tokyo 2020 Olympics in 2021. And tragically, we had our third death from thrombosis with thrombocytopenia syndrome related to the AstraZeneca vaccine, and already there was significant concern being expressed throughout the community about the AstraZeneca vaccine. And Victoria was again in lockdown. You were back in lockdown by June the 4th. That lockdown had started on the 27th of May. So we then tracked on just fine for a while until we opened our borders. And as we always knew that COVID-19 would arrive with a vengeance. Once we opened our international borders, we waited until we had the vast majority of people in Australia vaccinated with 2 doses of the COVID-19 vaccines. And at the time that we opened our border, little did we know that a new variant was about to appear, but of course we're expecting new variants all the time, and that was the Omicron variant, and that's the Omicron wave. And you can see we had a very sharp peak during January, and then it came down, and it looked like it was the end of the peak, and then it went up again, and we've kind of been on a bit of a plateau since that time. This shows the cases of Omicron by state, and you can see New South Wales is the big blue curve, and Victoria is the red one down below. So Victoria actually didn't have the same peak as New South Wales, but you've had a steady rise, and it's only just starting to decline a little bit at this time. And this is the comparison between metropolitan centres and rural settings across the country. And you can see how closely paralleled the two peaks are. So clearly with Omicron, once we open up the country, some of the rural areas which have been spared during other outbreaks got their first experience with COVID-19 as well. And of course that's affected many of you in your practices. June the 4th of this year, we've now had 7.3 million cases of COVID-19. We've had 8,600 deaths. And just to compare that from year to year, in 2020, 908 deaths, 2021, 1,331, 2022 so far, 6,400 deaths. Approximately a quarter of the deaths are in people who've not had a vaccine, which is absolutely tragic and which reinforces the need to try and get vaccinations into everybody who may have missed out, that 4% of the population. who've missed out on vaccination. We've also had over 57,000 cases of influenza reported this year, and we're seeing a sharp rise in the number of cases of influenza, and we have the influenza outbreak for this year. This winter has started already. It's started early, no surprise, again with the opening of the borders and the experiences that we've seen elsewhere. But we've also seen 38,000 prescriptions, PBS prescriptions for oral treatments written by GPs and dispensed by community pharmacists. 38,000 scripts of Lagevrio or Paxlovid. Can you give me a show of hands if you've prescribed Lagevrio or Paxlovid for your patients? Yep. So it's rising, and these treatments, if given early enough, can help prevent people from becoming seriously unwell and dying from COVID-19. And we are administering them not only to people who are unvaccinated, who are obviously at greatest risk, but to people no matter what their vaccination status is, because we're still getting real-world experience about the benefit of these oral treatments in very quickly reducing the viral load, particularly in elderly people. Half the prescriptions you've written have been for people aged 75 and above, more than 5,000 for people in aged care facilities as we continue to see outbreaks in residential aged care. The cases are now just starting to decline. This week, for the first time, we saw a decline. We had 250,000 cases reported this week compared to 340,000 the week before. So it may be that this Omicron wave is going to come down, but we expect COVID-19 will continue into the future. And we've had monkeypox. So a new disease appearing in Australia for the first time. As of yesterday, we've had 4 cases reported in Australia of that particular new disease, which, again, it reflects every time we change the way we live, a new disease emerges. Words of Roy Porter, the great medical historian. As we have changed the way we live with climate change and so forth, we're seeing new diseases appearing. And we have a new Prime Minister and a new government, which is starting its plans for what happens next. And you will have seen during the election campaign a number of promises which came forward from the new government, promises around GP grants, so grants to general practices. They've promised $220 million to general practices to support infrastructure, including for telehealth and other measures. We've seen the plans to strengthen Medicare with a task force which is going to be chaired by the new Minister for Health and Aged Care, Mark Butler. That's very significant, having the Minister themselves chairing a task force with the AMA, the RACGP, Consumer Health Forum, ACRM, NUTSHO, and organisations representing community nurses and allied health professionals. We obviously have our 10-year plan already, which Lynn mentioned, which the new government has said it will implement. That includes implementing voluntary patient enrolment, so the ability for your patients to enrol principally with your practice, and for payments to flow for those enrolments to improve chronic disease management and the multidisciplinary approach to primary care. Focus on multidisciplinary care, and particularly looking at the role of allied health in the work that we do. And I know that some of you already work in practices where you work in partnership with nurses and with allied health professionals. It's a model which works very well in delivering comprehensive primary care, GP-led primary care around the world. And there's this proposal for urgent care clinics, working with practices located near major hospital departments which are struggling. And obviously you'll have seen the media over the last week with the Premier from Victoria getting in lockstep with the Premier from New South Wales, seeking further support. I think that one of the things that's missing in the media is it's not only our public hospitals and emergency departments which are struggling at the moment, it's general practice and which is struggling as well, and the need to focus on building capacity right across our healthcare systems and not just in one particular area. So I'm going to stop there, Bianca, and if we've got time, happy to answer a few questions.
Thank you, Michael. Now, can you hear me through the microphone? Yep. Great. Okay. Now, I'm not seeing questions in the live Q&A, and I've tested it. I've popped something in there. So if you do have a question, and I can't take them from the floor, I do apologise. I think we are running close to time, so we will move on. But I guess I would like to reflect perhaps one question. So thank you. I think what you've laid out is a great description of what we've all been through and a vision for how things will change for the future. I guess the thing that I think about is some of those really important next steps, and we've been conversing through Project Echo and more broadly throughout the pandemic weekly about and understand well, I think as a community, the challenges that face primary care. I think we've done an incredible job, and I think our vaccination rates are an indicator, I think externally, but I think internally, I think there is a sense that we have communicated and collaborated to really try to coordinate our efforts locally, and so I want to acknowledge the hard work of all our GP teams and the PHN for that. I think really the big challenges that we've faced is the key pieces are that time to implement equals 0, the announcement that's made, and then primary care has to respond. I think we've done an incredible job at pivoting, but I think we have to recognise that some of the burden that comes to primary care and the workforce really does come from a lot of these changes, and often without little preparation. The population will find out at the same time as we might find out that we need to roll something out. I think our strength as primary care has been our efficiency and our agility, but I would like to see going forward a little bit more time to prepare and plan. I think what's come out of our echo as well is that preparing patients as well to understand primary care, as you say, messaging to help our communities to understand how primary care works and what they can reasonably expect, because we have faced, I guess, a lot of very angry people who are confused about how things work. I guess going forward, what I'm keen to hear from you is how we can improve. How do you see that improving, that time for getting our capacity ready to respond to what the request is at the legislative level, and also the communication with the public?
Yeah, so it's a big challenge, and it's a big challenge during a pandemic where decisions do need to be made very quickly, and we saw those decisions with the progressive decisions about closing our borders to protect the population, and with a number of measures which came out, and our political leaders not wanting to sit on decisions but be seen to be acting on them very quickly and very swiftly, often without a lot of consultation. Now, many of the things that we've seen happen in primary care have occurred in consultation with the representative organisations, with the AMA, the colleges, the Consumer Health Forum, the NACCHO organisation, and others. But it doesn't allow a lot of time to get information out to the members of all of those organisations and out through the PHNs. PHNs have been doing a great job as a communication arm, if I can say that word, of government, getting messages out very quickly as we can, as have all the peak organisations in getting messages out. But it does cause a lot of confusion, and I think we saw that last week with the announcement about free influenza vaccines suddenly occurring initially in Queensland. The Health Minister makes the statement, and nobody knows what the program is, how it's going to happen, what we do with our refrigerator full of vaccines that we've already purchased for sale to our patients. People immediately ringing up, wanting to get appointments for their free vaccines again. And you've all been through these cycles of an announcement's made and the phones run hot, for which I can only apologise, but it's happened again and again. So I think that part of what we need to be doing is working more together in a coordinated way, and that some of these announcements be forecast before they're implemented. But that hasn't been possible during the pandemic, where we've been all working together to save lives and needing to act very, very swiftly. I think the other there's lots of important lessons from the pandemic, but one of them is about the need for consistent information. And throughout the pandemic, we've tried to say, go back to health.gov.au, the Australian Government Department of Health website, as the source of information. But then each state and territory kind of does its own thing. And we've seen that causing lots of confusion around the country as well.
Thank you. Well, I think we have probably run short of time. I'm sure we could talk for a long time though, Michael, and I thank you so much for your time in coming down to speak to our community today. I know Michael's going to head off and see his mum, who is in Victoria, obviously, so that's been hard for you over the last couple of years, so I'm glad you can catch up with her. And we can keep in touch. So, I think, as you said before, if, people do want to ask questions, come through the PHN, but also health.gov.au. Michael runs webinars regularly on Thursdays. And of course, there's the newsletter that comes from you. So that's how we can keep in touch. So thank you for your time today. Appreciate it. And we look forward to hearing some more about some of the strategies from the federal government to, help build that resilience going forward, I guess, as you say. All right. So thank you. And we'll catch up with you again. Thank you. Now, I believe the app's not accepting questions. We might have had some communication from the floor that the app won't accept questions, so we might just need to pass that on to the conference organisers. So welcome everyone to the Westvic Primary Care Refresher Weekend. The theme for this year is Journey of Primary Care Through a Pandemic. My name's Bianca Forrester and I'm the conference chair and facilitator today. It's such a great privilege to come together again, both live and online. After 2 years of disruption and disaster response, I know we've all got a lot to talk about. So the stream will be facilitated today as a primary care stream alongside the GP stream, and Claire Daggerley, Regional Senior Manager of Barwon Southwest and the Communicable Disease Response Team, will be facilitating the primary care stream. I'll be facilitating the GP stream. Sessions run for 50 minutes, including time for Q&A. For our final session at 12:30 today, we'll bring both streams together for a plenary session, palliative care engagement during COVID-19. So, some housekeeping. In the coming weeks, attendees will receive a certificate of attendance for the conference and for any individual sessions you attend. This event is RAC, GP and ACRIM accredited. Now, our CPD team will apply for points on the behalf of GPs who attend all 4 sessions in a day. Nurses, allied health providers and GPs who attend a single session may self-report their professional development using the certificates supplied. All presentations are recorded and you will be able to watch any that you've missed through the portal from 8th of June to the 31st of July. And most sessions will be available on the Westvic YouTube, PHN YouTube Learn page. So, live and virtual housekeeping. So there's lots of ways to get involved with all the resources this weekend. Time's been allocated at the end of each sessions for questions to the presenters. So for those of you joining face-to-face, you can use the conference app, and at home using the live Q&A, which we'll come to in a minute. So for those of us attending face-to-face here and at Warrnambool and Ballarat, if you haven't downloaded the conference app already, do so now. And if we've got, on the conference app, do we have instructions as to the name of that for people? Yes. Great. So does everyone know the name of the conference app? GP? QR codes, that's coming? Yeah, beautiful. Do so now or put your hand up for assistance so we can send someone around to assist you if you are having trouble with the conference app. Okay, so pull that out and have a little look now so that you can submit, because we won't take questions from the floor, we'll do it through the app so it's equitable with those joining us from home. So if you're joining us online today, and for everyone who will be online tomorrow, we'll be using the online conference portal. Let's run through some of the online features so that you know what's on offer and where to find them. So, whether you're using the app or the conference portal, they're quite similar. When you're joining sessions, you are going to go to the program agenda button, simply click on the session you wish to join, and at the end of the session, click exit to return to the program and look for your next session. So for those at home, you're going to click the green on button situated at the bottom right of your screen. For those attending face-to-face, you're going to open your conference app, click on agenda. Is this all making sense live, guys? Yeah. And then click on the session. So that's how you go to the Q&A and other events. Okay, so everyone should see the following buttons: presenter session information, that contains the presenter bios, discussion forum for general comments and chat between delegates, but please don't use this to ask questions of the presenters, and live Q&A. All questions need to be submitted via the live Q&A tab, even if you're in the same room as the presenter. And just a reminder that you can upvote questions. That would help out greatly. Handouts, there's resources and slide decks are in the handouts section, and for the home From the home screen on both the app and the online portal, you'll see resources and sponsors. The resources contains all the Westvic program and project resources, and our sponsors, the valued conference sponsors, have provided information brochures and even some videos that you can view in the sponsor lounge. And if you're attending in Geelong in person, please do visit our sponsor tables during the break. So a quick one on IT troubleshooting. Being a hybrid conference, we are conscious that we may experience some technical difficulties and some bit of turbulence throughout the event. If that happens to you, please do bear in mind that I guess this is all a new world, and I'm certainly pleased that we're able to do both hybrid and live, but we're just going to have to get ourselves used to these new formats. So a few things to be aware of. If you're experiencing problems with sound and vision, it could be your internet connection if it's become low or unstable. So do check do your own troubleshooting with your internet connection. Do ensure you're on Google Chrome or Microsoft Edge, because these browsers are compatible with the conference portal. So if you're having problems, maybe it's about your browser. If you are otherwise having technical issues that you can't troubleshoot through those things, then do lodge a support ticket via the live support icon. Now, to increase a little bit of engagement, and I guess to make this whole process of getting onto online conferencing a bit fun, we're going to there's a little bit of a competition. So every time you click on a session, complete an evaluation, use the Q&A, visit the resource gallery or sponsor portals, you'll be earning points that will go into a grand prize draw, a lucky door prize, and that's a $200 red balloon experience voucher. So do keep an eye on it. You can see how you're doing in the tally, and there's a trophy that you can click on to see who you're competing against. The winner will be drawn at the end of conference tomorrow. So good luck, everyone. Finally, feedback and evaluation. We do really want to hear from you. So your feedback makes this great. Please take the time to complete the session evaluation after each session. That'll only take about a minute. And after the end of the conference, we'd really appreciate if you could evaluate the whole conference. That's a 5-minute evaluation, and you can do it at the end of the session, or you can, we'll send you a reminder, but we would really appreciate you evaluating it, because that really does feed into the workforce development, CPD team, teaching and learning surveys for the coming year. So it will help us plan next year's conference, but it also will provide a good insight into what you'd like to learn more about and hear more about. All right, when you attend your last session for the weekend, that's that. So, and of course, if you fill out that last evaluation, you go into the draw to win a 200 red balloon voucher. And we'll let you know a bit more about that as we go on. So we hope you enjoy the weekend, and we'd love to you to share your thoughts through Facebook and Twitter. You can use hashtag Primary Care Refresher 22 if you're tweeting at Westvic PHN on both Facebook and Twitter, at Westvic Primary Health Network on LinkedIn. And for virtual attendees, please now click on the green exit button in the top left-hand corner, and we'll see you in either the GP or primary care stream at 10, well, shortly. 10 now. Yeah.